Hello, I'm Nathan Tirabassi, and this presentation is for my Sociology 100 course. The article I chose to analyze was social workers and students' attitudes toward electronic tracking of people with Alzheimer's disease. Warner and Lanu are the authors of this journal and published this copy in August of 2011. In this article, Warner and Lanu wanted to discover the opinions of social workers, students, and practitioners on whether or not GPS are practical and acceptable to be used on dementia patients. Throughout the journal, the hypothesis of the GPS that are implemented onto a patient of dementia can ultimately decrease the burden that the caregiver has and is mentioned. In the article, the authors suspect that the independent variable of the status of social working students versus the status of social working practitioners will directly correlate to change the attitudes toward the use of GPS to monitor the patient, also known as the dependent variable of this study. To test their hypothesis, the authors decided to use a questionnaire survey to gather data. The sample size of this questionnaire is very small. The group of people that were studied was narrowed into a category of only social workers and social students. 55 social workers participated and only 61 social work students participated. To create this questionnaire, the researchers compiled multiple factors and decisions that would portray the tested group's opinions, such as how important the safety of the elders is taken into consideration or whether they oppose the use of GPS altogether. After all of the data was gathered, the researchers found that a high degree of importance was placed by both social work students and professionals on the value of respecting the elders' autonomy. This reflects their hypothesis of usage being dependent on the caregiver and the patient's circumstances. Warner and Lanu were aware, in hindsight, that a few critical components of this survey could have been altered to drastically improve the accurateness of their collected data. First, the sample size was admittedly small and may have been biased, and some of the social workers were recruited from an ethics conference. Also, the authors noticed that the selection of students they surveyed were all second and third year students. This could affect the outcome of answers due to the fact that a first-year student may not have the same amount of knowledge as the elder students obtain. The researchers came to the conclusion that if they had personally interviewed or had been present while the researchers were answering the questions, it could have led to a different outcome. They also did not have a disclaimer of whether or not this data being collected would be confidential. In fear that the subject's opinions on such a topic could become public knowledge, also may affect the way a few research subjects went about answering the questionnaire. Exogenous factors, factors that are influenced by the environment, are the kinds of things that the sociologists would focus on. A sociologist would be interested in what kind of role the family would play in the decision of giving the caregiver the go-ahead to implement the usage of GPS on a patient. Sociologists would say that the society is ultimately making the decision. Endogenous factors, factors that are classified as internal, are what a psychologist would focus on. The endogenous factors are hailed from the brain. In a situation like this, dealing with a dementia patient, a psychologist would say that ultimately the use of the GPS on the patient would have to be determined by the severity and specifics of their diagnosis. So that I could obtain a better understanding of my article, I selected another article related to the Alzheimer's disease. I chose the article entitled Family Issues in the Care of Persons with Alzheimer's Disease, which was published 10 years earlier in 2001. Throughout this journal, it presents facts about how the family and/or caregivers should go about living and taking care of dementia patients. This article, written by P. Dylan Andersworth, allows me to better understand why the research subjects from the first article came to their conclusion and how they might go about understanding if patients should be tracked. Thank you.